Welcome. In this video, we'll be exploring a specific type of cataract linked to diabetes, diabetic cataract. We'll delve into the causes, symptoms, diagnosis, treatment, and preventative measures you can take to safeguard your vision. Diabetic cataracts, as the name suggests, are strongly associated with diabetes. The primary culprit is prolonged exposure to high blood sugar levels. While anyone can develop cataracts as they age, people with diabetes are at a significantly higher risk and tend to develop them at a younger age. Poorly controlled blood sugar is the main etiological factor, leading to a cascade of events that damage the lens of the eye. Let's talk about what happens inside the eye. High blood sugar causes an excess of glucose to accumulate in the lens. Enzymes convert this glucose into sorbitol, a sugar alcohol. Sorbitol is poorly metabolized and tends to accumulate within the lens fibers. This accumulation draws water into the lens, causing it to swell and become less transparent. Over time, this process leads to protein clumping and clouding of the lens, the hallmark of a cataract. Diabetes is a prevalent condition, and unfortunately so are diabetic cataracts. The prevalence of cataracts is significantly higher in individuals with diabetes compared to the general population. The longer someone has diabetes, and the poorer their blood sugar control, the greater their risk of developing these cataracts. Studies have consistently shown a strong correlation between diabetes duration, HbA1c levels, and the likelihood of cataract formation. The signs and symptoms of diabetic cataracts are similar to those of other types of cataracts. Common symptoms include blurry or cloudy vision, difficulty seeing at night, increased sensitivity to glare, seeing halos around lights, and experiencing a fading or yellowing of colors. You might also notice frequent changes in your eyeglass or contact lens prescription. Diagnosing diabetic cataracts involves a comprehensive eye examination by an ophthalmologist or optometrist. This typically includes a visual acuity test to measure your sharpness of vision, a slit lamp examination to examine the structures of the eye, including the lens, and a dilated eye exam to get a better view of the lens and other parts of the eye. These tests help the eye doctor assess the severity and type of cataract present. While cataracts are broadly classified into different types based on their location and appearance, diabetic cataracts don't have a distinct classification separate from other cataract types. They are usually described based on their morphology, like nuclear, cortical, or posterior subcapsular. Just like any other cataract, the association with diabetes simply implies that the development of the cataract is linked to the metabolic effects of the disease. The primary treatment for diabetic cataracts is surgery. Cataract surgery involves removing the cloudy lens and replacing it with a clear artificial lens, called an intraocular lens or IL. This is a very common and generally safe procedure. Managing diabetes and controlling blood sugar levels is crucial both before and after surgery to promote healing and prevent complications. Good glycemic control optimizes the surgical outcome and helps to minimize risks of further visual problems. Prevention is key. The most important step in preventing or delaying the development of diabetic cataracts is maintaining strict blood sugar control through diet, exercise, and medication as prescribed by your doctor. Regular eye exams are also essential to detect cataracts early and monitor their progression. Protecting your eyes from excessive sunlight by wearing sunglasses can also help. The prognosis for vision after cataract surgery is generally excellent. Most people experience a significant improvement in their vision after the procedure. However, it's important to remember that diabetes can also affect other parts of the eye, such as the retina's diabetic retinopathy. Managing diabetes is crucial to prevent further eye complications. Recent research is exploring non-surgical treatments to slow cataract progression, but surgery remains the gold standard for vision restoration. Studies are also focusing on advanced IOL designs to improve visual outcomes and reduce dependence on glasses after surgery.